Recently, Barrie hosted events to highlight mental health challenges, racism, and available resources to address these issues. Flora's Walk was organized to raise awareness about perinatal mental health, honoring Flora Babakhani, who passed away in 2022 due to undiagnosed postpartum psychosis. Candice Thomas, CEO of Evergreen Wellness Studio and organizer of the walk, shared with Simcoe Community Media that 1 in 5 women experience perinatal mental health challenges and approximately 1 in 1,000 face postpartum psychosis.
So at Evergreen, my clinic, we offer free and reduced fee funded therapy services and free group counseling services. There are a lot of other clinics in the city that offer reduced fee therapy, and the idea behind that is to remove the financial barrier to care because it is costly to go to therapy, and to help reduce the amount of wait lists and wait times that mothers are experiencing. If a mother is experiencing postpartum depression, they need to be seen now and not later. And too often a mother's being put on a wait list, and that is just unacceptable to me.
At the event, representatives from Ontario Structured Psychotherapy and Walk's Mental Health were present. Ontario Structured Psychotherapy offer free evidence-based cognitive behavioral therapy to individuals aged 18 and above.
So we are a short-term psychotherapy program. So cognitive behavioral therapy, first of all, it is an evidence-based form of psychotherapy. So it's a little bit different than talk therapy or supportive counseling. Cognitive behavioral therapy really gives you skills to be able to manage your mental health. So
if there was some kind of a funding mechanism that allowed people to access mental health support similar to an OHIP card, would be unbelievable. That way there would be no barriers for people accessing mental health support. It's interesting, in capitalism, we're very big on productivity, but we don't realize that humans are really important and they're part of the economy.
Simcoe County residents can also access mental health resources through Barrie and Area Ontario Health Team.
So I would say it's a work in progress right now. We are one of the partners that are contributing to the, they're called Heart Hubs, the Homelessness and Addiction Recovery Treatment Hubs. So we're providing some of the administrative support there that's working with the County of Simcoe and Canadian Mental Health Association, and a number of partners that sit at that table that are trying to bring these resources for that population as well.
Additionally, racism faced by minority communities can have multiple adverse effects, including impacts on mental health. Parents Against Racism provides support and resources to parents and children in Simcoe County schools. The organization is seeking volunteers and additional resources such as space.
Always seek to understand somebody else's experience and point of view, and when they tell you what they've experienced, believe them. That's the best thing that each of us can do in the community. A lot of time there is a sense of that can't be happening, or that's not real, or they didn't mean for that to happen. And what I've learned in my journey, and it's still ongoing, I learn something new every day about this work, but you gotta believe people when they tell you what they've experienced, and your experience isn't everyone's experience. So be open to listening and learning to what other people within your community are going through.
Following are our interviews and coverage of the events.
I am leading the 4th annual Flora's Walk here in Barrie, and our goal is to help raise awareness for perinatal mental health services and programming within our community and beyond. So Flora Babakhani tragically took her own life due to undiagnosed and untreated postpartum psychosis. So every year we raise funds and we offer this walk, and it's happening across Canada. It's to remember the women like Flora, the mothers that tragically have lost their lives. And we come out today because we're going to raise awareness, and the funding is going directly back into the communities to help to ensure that no mother feels left behind. Perinatal mental health illnesses affect 1 in 5 women. 1 in 1,000 experience perinatal psychosis, postpartum psychosis, and that is what Flora had. And if it goes untreated and undiagnosed, this is something that mothers are dying from. So we're hoping to raise awareness so that more mothers feel seen. Perinatal mental health isn't rare. It happens all the time, and a lot of mothers go unseen. And so today, Flora's Walk, mothers are being seen and heard. So at Evergreen, my clinic, we offer free and reduced fee funded therapy services and free group counseling services. There are a lot of other clinics in the city that offer reduced fee therapy, And the idea behind that is to remove the financial barrier to care, because it is costly to go to therapy, and to help reduce the amount of wait lists and wait times that mothers are experiencing. If a mother is experiencing postpartum depression, they need to be seen now and not later. And too often a mother is being put on a wait list, and that is just unacceptable to me. The provincial government has heard us. Our MPP, Andrea Kanjan, has heard us, and she helps advocate for us. And we just launched and published the very first Canadian perinatal mental health guidelines. So across Canada, we've never had a standard of care. There's never been guidelines for patients and families and practitioners to follow. And just this year, we published the Canadian perinatal mental health guidelines, and it's called Seeds of Hope. And so now mothers have access to information and resources right there when they need it. And it's online, you can download the book, or you can have it in a physical copy. To be honest, my number one message this year is that hope can save a life. But when I say hope, I mean just getting a mother to feel seen and feel heard. That can honestly save a life. It saved my life. I had one person notice me, and that saved my life. And I think the more that we reach out, and the more that we ask, are you okay? And the more that we find supports from others sooner rather than later, that all of those things are going to save a life. And for families to always be there and support, because mothers don't always, it's not obvious. Postpartum depression doesn't walk around on our faces. I feel like it's something that we keep to ourselves at times, so you always have to check in. So I would say hope really and truly can save a life.
I mean, perinatal mental health is something that not everyone knows is a thing, right? And people don't always know that there's care for the moms who are also going through this, right? So I know a lot of us who work here, myself included, either are moms-to-be or new moms or existing moms, right? And we understand exactly what it is needed to be able to have a community, right? So we know that we need that support. We need understanding. We need just the knowledge that these services are available, right? So that's why we're here at Flora's Walk today, to really just share the word about our programs, let other moms and families know that we are here, we are accessible, we are available, and just to know that they're not alone, right? So it's never too late to reach out for help. And so the services that we offer are here for you at any point in your journey. But we are definitely here if you're just starting out and kind of not knowing where to turn, if you're feeling stuck in that perinatal stage. So we're proud to be able to offer that service for that reason. So I'm here with Ontario Structured Psychotherapy. We offer free evidence-based cognitive behavioural therapy to anyone ages 18 and up who are struggling with symptoms of depression, anxiety, post-traumatic stress, but also especially perinatal mental health issues. So we offer a range of services, anywhere from self-guided programs to therapist-led programs and groups. And most recently, we've started an actual perinatal program where we offer 6 to 8 sessions based on behavioral activation principles, which really help, either women who are pregnant or recently postpartum reconnect with themselves, with their communities, and really just build their supports in their network. So something that we're really proud to be able to offer. But either way, our program is kind of based out of the Central North region. It's free. You can provide a self-referral or you can get a doctor's referral, but it's really easy to access. And we're really proud to offer this service in our community. So we receive funding from Ontario Health, so we are government funded, so there's no cost to clients, which is amazing. We're really accessible in that sense. There's obviously no cost, very low wait times, so it's very accessible for anyone who needs it in a timely manner. So we are a short-term psychotherapy program. So cognitive behavioral therapy, first of all, it is an evidence-based form of psychotherapy, so it's a little bit different than talk therapy or supportive counseling. Cognitive behavioral therapy really gives you skills to be able to manage your mental health. So the way that it works essentially is our short-term programs. So we have the self-guided programs that are typically anywhere between 8 to 12 weeks or so, either delivered through workbooks or online supports. And those programs are still supported by a therapist or a coach. But then our one-to-one kind of higher intensity therapist-led programs are delivered between 8 to 16 sessions. So again, short-term, but in that kind of therapist-led program, you'd be getting those 8 to 16 sessions on a weekly basis, either available virtual, over the phone, or in person at any of our service locations. So we have different service delivery sites across the North Simcoe Muskoka region. where we offer these services in person as well, which is really great. Yeah, and here's the thing is that everybody's journey towards getting help for their mental health is going to be different. Some people are definitely ready, some people need a little bit more support. If anyone's kind of just thinking about getting support, they can always reach out to a family doctor who would know about our services, or visit our website at therapyontario.ca. We have a wealth of resources on there as well, just to kind of help you understand what you're going to get yourself into if you're looking for therapy, what you might expect if you're looking for therapy. But I just want to say it's not as daunting as it may seem. People like us that provide the services have often received services ourselves, so we try and make it as accessible as possible and as easy to access as possible and as comfortable to access as possible. So that's why we offer it in such a range of services. So if you want to just do something online with very minimal therapist communication, you have that option. Or if you want to do something that has more therapist communication, you also have that option. So it's nice that we offer kind of that range of services to meet people exactly where their needs are at or where their kind of wishes for service are at too. For OSP Central North, we are based out of Waypoint. So Waypoint is based in kind of Midland area. However, we have service locations all across Muskoka, Simcoe County, Dufferin County. So we go all the way as far north as Sundridge in Muskoka. We go out to Collingwood. We have offices in Orangeville, for example. So we have quite a wide range of locations that we can access services through. But everything is also available through Zoom, so virtual services, our online programs, or essentially just phone as well. So there's a really, really wide range of accessibility means for this program.
So I'm a social worker, and I've been working with people in a professional capacity for over 15 years. And what we see is that there's a lack of support and even understanding of what's happening for moms and dads during that perinatal and postpartum season. And so today's event's really important. It's raising awareness around those struggles, how it affects our mental health, and gathering some awareness and support so that people can go through that season and thrive coming out of it. Well, there's so many different things that can happen during carrying a child, birthing a child, and then raising one, where mental health can struggle. So there's massive hormone surges that are happening at different points of that journey. Lack of support for people around them. Some people don't have any local family. They say it takes a village to raise a child, and these days you have to pay for the village. The village doesn't just naturally exist anymore, right? And because of that, a lot of women and moms and dads are in isolation, and so they're falling through the cracks. Lack of access to family practitioners, really difficult. Overall health and mental health, really difficult for women. So I would say let's include conversations around mental health for the entire journey. Before you even think about having a child, let's talk about what kind of supports do we have, what kind of needs do we think are going to come up, and then during the whole pregnancy, are you starting to experience intrusive thoughts? Are you starting to have an increase in anxiety? Is your mood going low? Keeping that dialogue with your health practitioner, whether that's a midwife, an OB, a family practitioner, and especially with the season after. What do you need as far as getting sleep, right? It's very hard to recover your mental health if you are not sleeping, and a lot of moms are not sleeping. Do you need family to come? What kind of boundaries do you need? Do you need them not to come? But keeping that conversation going from the moment you decide you want to conceive all the way through as you're raising a little one. So our team is all registered social workers. So we have people on our team that specialize in a different range of practices, from little kids, family support, a lot of couples therapy, especially during the transition, adding a child. We see a lot of struggle with couples and family dynamics. So different people on our team have different specialties, and we try to find the right fit for everyone. It's not covered by benefits, unfortunately, our services, but we are actually considered a federal medical expense. So people can take their receipts and submit it at the end of the year, and it does qualify for a medical expense. Most people's benefits do cover our services. However, we do have an affordable therapy program. Thank you, sweetheart. We do have an affordable therapy program where we cut services down about 70% so that people can access them at an affordable rate, even if they don't have any benefits. Oh, it would be unbelievable if people could have access to mental health care, similar to how they've been supporting dental and optometry. If there was some kind of a funding mechanism that allowed people to access mental health support similar to an OHIP card would be unbelievable. That way there would be no barriers for people accessing mental health support. It's interesting, in capitalism we're very big on productivity, but we don't realize that humans are really important and they're part of the economy, right? So I understand it's an expense, but it's one that is an investment, because when you invest in people and people are healthier, everything, you get your return in investment, right?
Yeah, so we are an organization that connects, we have close to 50 collaborators and partners that help support patient care through social and healthcare services. We're the operations team side of it. Yes, so we have partners that work in acute care, like our Royal Victoria Regional Health Centre. In mental health, the Canadian Mental Health Association of Simcoe County is one of our partners. We have social care services like the Alzheimer's Society, Hospice Simcoe for palliative care. Pretty much every sector of healthcare falls within our partnership. So the Barrie and Area Ontario Health Team, we don't provide direct patient care, but we support our partners that do. We try to help support through navigation to make it easier for patients to get from point A to point B when they're navigating those healthcare services. We also help to coordinate clinics and things around the area where there's a partnership between maybe the Canadian Mental Health Association or the hospital, and we help to the operations side of it. We have a mental health and addictions working group, which would be made up of various mental health providers throughout the region, and they would have a list of deliverables that they're working towards to achieve to help kind of make care more seamless around the area. Yeah, so we're here today actually sharing services that are for newcomers, for people that are in the area that maybe don't have access to a primary care provider like a family physician or a nurse practitioner. So we are sharing today a list of services that they can access clinics and healthcare in a way that's a little bit easier for them.
What are the services available, for example, for LGBTQ plus community in the area?
Yeah, we work closely with the Gilbert Center, and so through their partnership, then we're able to not just have a voice at the table that's representing that community, but also be able to access the services that are provided through that organization. So I would say it's a work in progress right now. We are one of the partners that are contributing to they're called Heart Hubs, the Homelessness and Addiction Recovery Treatment Hubs. So we're providing some of the administrative support there that's working with the County of Simcoe and Canadian Mental Health Association, and a number of partners that sit at that table that are trying to bring these resources for that population as well. I think there's two big issues within our area. I mean, navigation is huge. It's a very complicated system, so the Ontario health teams are there to try and provide support there so that it's easier to figure out where you need to go to get the right care at the right time. And then I think the other piece would be on primary care. We know there's thousands of residents in our area that just don't have access to a family doctor or a nurse practitioner. So we're trying to work with our partners to bring these clinics in so that we can get those patients that are unattached, that don't have the family provider, attached to care.
We started about 4 years ago as a group of parents in the community. The president of our organization had gone through some pretty significant trauma within the school board here in Simcoe, and had to reach outside of the community for support and assistance, and realized that there was a real need. She started a parent support group, and it has since 3 years ago turned into a nonprofit. It really organically evolved into a system navigation service, which has since expanded. We offer our Harambe program, tutoring, counseling. We have women's events coming up May 30th. We've got lots of activity on social media for people if they'd like to follow along and see what we're doing. We do Black History Month Gala every year. So we've really expanded it quite quickly over the last 3 years, but the core of our business is system navigation. And what that essentially means is that if you or your family is having any kind of challenges within systems here in Simcoe County, be it primarily school education system, but policing, child welfare, daycare services, healthcare, etc. We can help the family get resolution, resources, services that they may not otherwise know about. And there's also power in just showing up in numbers. When you go through something with your child, it can be really overwhelming. You're there with 5 different administrators and educator, faculty members within the school or the board. And so having your own support to show up with you and listen for cues and ask pertinent questions to get the resources to really enhance your child's experience helps. So that's what the core of our business is, but as I said, we do have a lot of other community programming that we're offering right now. Well, I have to be careful because there is confidentiality, but we can help with things like additional resources within the school that may not be otherwise known about. Schools can offer things like transitional EA support at times. It does need to be approved. There's no guarantee on what services can be offered, but we have a good grasp, and Natasha, the president of our organization, has worked within the school board specifically and mental health, and so has a very good grasp on what is available out there that not all parents are offered. We operate within Simcoe County right now. However, we're here to help. So we certainly have taken intakes from neighboring system navigation organizations like Parents of Black Children. They've sent a few parents our way. And so, our bandwidth is limited. We're actively growing our organization to increase the funding that we have so we can offer it to more and more communities. But right now we're pretty much Simcoe focused. We can always make good use of space for our tutoring programs. Funding is there's never enough funding to go around for this type of work. We are a volunteer-based organization, so if there are community members that have skills in grant writing, web design, social media, and they want to add volunteer hours, we're always looking for that type of support as well. I have not seen us turn anyone away, that's for sure. We do focus on the racialized community here in Simcoe, and because of our base, because of the network that we're very connected to with our family demographics and the schools that we participate in as community members, we find that we support largely Black and Indigenous communities here, but it's not exclusive. And we've also helped many families that's children are, in the special, have special needs, and maybe they're not able to advocate for themselves as well, and they're having some challenges within the school. So, I want to say that because our resources is limited, of course we have to be cautious. We haven't done a ton of advertising. This is all word of mouth at this point. That's led us to where we are today, 3 years in. But I've never seen us turn anyone away.
Any message, for Simcoe County residents, whether it's white community or whether it's other immigrants, because even, as I said, even the minority communities, Black and Indigenous people face, disproportionate, racism compared to South Asian community, which I belong to. So, do you have any message for other communities, what they can do to support everyone in the county?
Oh, that's a really great question. I would say always seek to understand somebody else's experience and point of view, and when they tell you what they've experienced, believe them. That's the best thing that each of us can do in the community. A lot of time there is a sense of that can't be happening, or that's not real, or they didn't mean for that to happen. And what I've learned in my journey, and it's still ongoing, I learn something new every day about this work, but you gotta believe people when they tell you what they've experienced, and your experience isn't everyone's experience. So be open to listening and learning to what other people within your community are going through.